Welcome to Little Steps, Big Gains in part 2 of our discussion on visual impairments and Parkinson's disease. In part 1, we talked about some of the most common types of visual deficits seen in Parkinson's disease and functional applications. A link to that video is in the description below. Here in part 2, we are going to discuss skilled interventions to address these impairments. If you find this video educational or helpful, please press that like, subscribe below. In part 1, we learned that 78% of individuals with Parkinson's disease report at least one visual symptom. Things like difficulty reading, double vision, misjudging objects or distances. And it is for this reason that we're discussing visual changes in Parkinson's disease. Now, in part 1, we talked about some of these. We talked about contrast sensitivity, color vision, peripheral vision, motion and social perception, spatial orientation, oculomotor control, and then we talked about double vision. Now, what can we do about these changes? That is what we're going to discuss here in this video. We're going to go over 7 different interventions that might help. Number 1, dopaminergic medications. Now, to understand how dopaminergic medications affect the visual system, we need to first learn the role of dopamine in the retina. When it comes to the visual system, there is this thin layer of tissue in the back called the retina. Now, the retina has things like cones and rods, they're photoreceptors. Cones are responsible for vision during high light environments, spatial acuity, and color vision. Rods, on the other hand, are responsible for vision in low light environments. Now, why is this important? Well, attached to those photoreceptors, we have dopamine neurons, okay? Dopamine neurons send messages between the neurons, and here in the retina, they increase signal flow to the cones, and they decrease signal flow to the rods. So if we have a deficiency here, this is called a retinal dopamine deficiency. And that is what contributes to those changes that we talked about in contrast sensitivity, color vision, and spatial acuity, knowing where things are in space. So it's for this reason, now we know why, that studies show that contrast sensitivity loss can actually be partly reversible with L-DOPA treatment for individuals in early to mid stages of Parkinson's disease. I do have to say, though, that eventually does deteriorate again as the disease progresses. Number 2, create a home of contrast. In part 1, we learned that Parkinson's disease can reduce contrast sensitivity. What is contrast sensitivity? Well, that's that ability to discriminate an object from its background. So, what is one thing we can do is create a home of contrast. What do I mean by that? Okay, I was just at a patient's home and we're staring into their shower. The first thing we see is a beige shower mat on the outside with white tile. Then the shower has white tile with a white shower mat. We have white walls, guess what? White grab bars, and then a white shower chair. Talk about difficult to navigate. So we put contrast tape along the threshold to be able to see it. Friction contrast tape on those grab bars that'll provide some friction and make it easier to see. We put a bright red towel on top of that shower chair. Let's make this easier to see those items. What are some other examples? Well, here we can have blue toothpaste on a white toothbrush, or things like a colored plate for white mashed potatoes. Those are a few examples of how we can create a home of contrast. Number 3, adding visual cues. Alongside adding contrast, we can add some visual cues. What do I mean by this? Okay, well, in part 1, we talked about some of the changes in the visual system include changes in the peripheral vision, motion perception, difficulty visually scanning, visual acuity, knowing where things are in space, and all of those changes can really complicate such tasks like walking to the bathroom. So, what can we do? We can add visual cues and we can simplify all of this. And I gave some of these ideas in a video on tips to prevent freezing and shuffling. And you can find that video in the link below. But here we are once again simplifying things. Let's remove clutter. Okay, we don't need to deal with that on the way to the bathroom with all of these visual changes already. And then maybe we can simplify more by adding visual targets, such as stickers on the floor, as to give that cue to the brain where to go ahead and put that foot for footfall placement. Let's just simplify all of that. All right, what are some other examples? Well, how often is it that an individual with Parkinson's disease may go to sit in a chair and sit halfway or sit too soon? A lot of this may be due to difficulty with spatial acuity, knowing where things are in space, or perhaps, like we talked about, difficulty visual scanning, especially to that left side. So what we can do here is, once again, add some visual cues. Maybe put some tape on the armrest and practice looking to both sides for that tape before sitting. Or another example is with reading. What we can do is get like a red bookmark or something like that. And as you read, put that bookmark along the left side of the page. Really cue your eyes to look all the way to that bookmark before starting the next line. That's another example of adding visual cues that make life easier. Number 4, oculomotor exercises. In part 1, we talked about oculomotor coordination. We learned that Parkinson's disease not only affects the coordination of the muscles of the limbs, but also the coordination of the muscles around the eyes. A few examples: saccades. That is the ability to jump back and forth between targets, those eyes. With Parkinson's disease, we tend not to jump far enough. Studies show this can contribute to freezing with pivoting. Another example, convergence. That is the ability to bring the eyes close together and focus on a nearby target. Okay, unfortunately, convergence insufficiency is very, very common in Parkinson's disease. And a few symptoms include eye strain, blurry vision, headaches, double vision, losing one's place on a page. Those are a few examples. So the question is, can eye exercises, oculomotor coordination training help? Well, that is a question that's currently being researched at the time of this video, but there are some promising studies. In one case study below, 2 individuals with Parkinson's disease did 8 weeks of eye exercises to address convergence insufficiency. After the program, they did have a reduction of symptoms. A second study below looked at voluntary saccadic eye training, and after the program showed improvements in the strength of the eye muscles and voluntary saccadic control. A third study below looked at individuals with progressive supranuclear palsy. When they combined oculomotor training with gait training, they found improvements in stance, time, and walking speed. They concluded that the rehabilitation of gait with progressive supranuclear palsy should include oculomotor training. However, research for oculomotor training in Parkinson's disease is currently limited. At the time of this video, clinical trials are currently being conducted. Because it may be of benefit, there is some promising research out there. Individuals struggling with oculomotor control may want to ask their eye specialist to see if vision therapy with oculomotor exercises could be of benefit to them. Number 5, get regular eye exams and see a neuro-ophthalmologist. In general, it is so important to get those regular eye exams because this can address treatable causes of vision loss like cataracts. Second, it can be really advantageous to see a neuro-ophthalmologist. These professionals bridge that gap between neurology and ophthalmology, and they can treat and diagnose visual manifestations of neurological conditions. Now, a few examples is they may prescribe vision therapy, maybe prisms to address convergence insufficiency. They may look at lens tints to address that contrast sensitivity loss. These professionals are a fantastic resource. Number 6, treat dry eyes. Often individuals with Parkinson's disease have either excessive or decreased blinking. In fact, studies show that a reduction in blinking rates is a clinical feature of Parkinson's disease. Now, we're including this here because that reduction in blinking rate can cause dry eyes with the poor production of tears, or actually watery eyes and blurry vision. And this is also, think of a windshield wiper where that wiper is supposed to clear the water. So what we can do here is bring this up to your doctor. Talk to them. They may prescribe artificial tears and they will recommend good eye hygiene. Number 7, art therapy. While art therapy may seem way out of the box, I'm including it because there is this study below that showed that art therapy can alleviate some of the visual effects associated with Parkinson's disease by reorganizing the visual networks. This study below used clay manipulation, drawing, painting, and collage. So while Parkinson's disease does affect that visual system, there are some things that might help. Some of those things we discussed include dopaminergic medications, creating a home of contrast, adding those visual cues, oculomotor exercises with vision therapy, seeing your eye specialist, get those regular eye exams, treating dry eyes, and art therapy. If you found this video educational, please press that like button below, subscribe, and check out my channel for free educational videos and free home exercise programs, because together, little steps, we can make some big gains.